Recording started.
Good morning and welcome to today's webinar on workplace violence. My name is Sean McGinnis. I'm a safety and health consultant with the Pennsylvania OSHA Consultation program here at IUP. Some general information about this webinar. It is being recorded, and the recording as well as the PowerPoint presentation will be posted on our website. Audio for this presentation is available only through your computer speakers. The chat question area is open. We will not be answering the chat questions live. Due to the technical nature, we will answer those questions and have those posted on our website within the next 7 days. So first, with workplace violence, we have to identify, is there a problem? Well, looking at some fatality data statistics, in 2014, there was a total of 4,679 workplace fatalities, of which 409 were workplace homicides. So roughly 9% of all workplace fatalities were attributed to workplace violence. Some stats with that, 83% of these people were males, and 32% were working in retail establishments. Some non-fatal stats, in 2014, there was nearly 16,000 non-fatal injuries resulting in days away from work related strictly to workplace violence. 67% of these were to females. 69% of them occurred in healthcare and social assistance industries, which we'll talk about those a little later. And 23% of these required days away from work more than 31. So what types of workplace violence is there? Well, the first type would be criminal intent. Those are workplace violence events that the perpetrator has no legitimate relationship to the business. Typically, these are associated with crimes being conducted in conjunction with it, such as robbery, shoplifting, or trespassing. So we see these types of things on the news on a regular basis. The second type would be those from customers, clients, or patients, where violence is directed at employees by those people, or others who the employer provides a service to. In this case, we see it a lot more in the healthcare industry, which we'll talk about. The next type is your coworkers, violence by a current or former employee. This could be coworkers, supervisors, managers. A lot of times this comes from disgruntled employees or people that have been laid off or let go in the past. The fourth type of violence would be those of a personal nature, where the individual, the perpetrator, has no connection with the business per se, but is known or has personal relationships with someone that works there. I've seen and heard stories of large retail establishments having issues like this, where an employee came in and either shot or assaulted, and a person came in and either assaulted or attacked an employee who was there, and it was an estranged boyfriend, husband, something like that. So what risk factors do companies have that would trigger them to start looking to see if they have issues with workplace violence? One, contact with the public. Are people free to come and go into the facility? Another one would be exchange of money. Is there a potential for or an opportunity for a criminal activity? Delivery of passengers, goods, or services, or potentially having a mobile workplace such as a taxi cab or a police cruiser. Another one would be working with unstable or volatile persons in the healthcare, social service, or criminal justice settings. Additional risk factors, working alone or in small groups, working late night or during early morning hours, where typically a lot of criminal activity will occur, working in high crime areas, guarding valuable property or possessions, maybe working in community-based settings such as group homes, or if there's unrestricted movement to the public, where we look at maybe hospitals or retail establishments. So in preventing workplace violence, we want to plan out what we're going to do. And in planning, there's really 5 major components to it. The first one being management commitment. And we're going to look at all these in a moment. Identifying risk or doing a worksite analysis, hazard prevention and control, conducting training, and doing evaluations. So this type of system of planning is not for just workplace violence. This is something that you apply to all your safety and health programs. So when we talk about management commitment, this is where it needs to start. Management is there and they need to provide a motivating force to implement, recognize, and control workplace violence. They need to understand there is a potential there based on those risk factors. They need to establish zero tolerance policies. This includes horseplay. A lot of times the workplace violence associated with coworkers starts off as horseplay. There needs to be a system in place where employees are free to report incidents without being held in trouble for saying something. There should be an encouragement system in place for those threats to be reported. And this applies to employees and clients. So not only is our system set up to communicate that to the employees, but also say we're in a hospital establishment or a patient care facility, the clients need to know that, and potentially the clients' families need to know of the workplace violence policy. The second step is doing a risk analysis. So we want to look at our vulnerabilities, keeping in mind all 4 types of workplace violence, whether it be personal, or if it's criminal, or if it's customer, patient, or coworker. Analyze workplace security. Is there anything in place? Examples might be closed circuit video, or alarm systems, or the way the doors are locked. Another thing to look at with that analysis is employee input. So you want to ask your employees where they feel unsafe, or have there been incidents that weren't reported, so that you can get some good data to be able to identify where the hazards are. You want to look at trends of incidents, maybe past accident reports or incidents that were reported, maybe your OSHA logs, and also look at problematic behavior, whether it was from employees or clients, and identify those as potential risks. So when we get into controlling hazards, no different than with any other safety and health management system, we want to start off with our engineering controls. So some examples of engineering controls associated with workplace violence would be alarm systems. Not only are they in place, but are they tested on a regular basis? Video surveillance, making sure that there's adequate lighting in the facility. Depending on the type of environment, maybe metal detectors would be necessary. Arrangement of workspaces, making sure there's not any hidden places where things can occur. And look and see if there's emergency phones and phone numbers available for these employees to report incidents. And making sure that doors are locked if they're unused or in back areas, obviously in accordance with local fire codes. Making sure that in emergencies we do have them accessible, but we're not allowing people off the street to enter the facility. After we exhaust our engineering controls, we're going to look at administrative controls. Those would be things like zero tolerance policies and making sure that employees know that there is a zero tolerance policy. Another one would be incident reporting, basically establishing a system of reporting the incidents. As I said before, there can't be any fear of the employee reporting something. Local law enforcement relationships. This is a good one. Local companies I've spoke to have brought in their localities, their state police, or whether they're local police, brought them into the facility and done walkthroughs and looked for potential risks. So that's a good thing to kind of reach out for and to check with those groups. Another thing in administrative control is responding to all complaints, making sure that everything is investigated. You can't look at something and say, oh, it's just Johnny being Johnny, nothing's going to happen. You have to assume that it may happen and respond to that complaint. The next one we're going to get into a little more is training, making sure employees are properly trained. Another one is conducting drills. I dealt with a facility in Erie that they actually had a Nerf gun. The safety manager had a Nerf gun, and twice a year they ran an active shooter drill with a Nerf gun. You know, they were conducting drills. Pre-employment screenings, looking at people's past histories to make sure that they're not bringing any potentials for workplace violence with them. And same thing goes with client screenings. Say home nursing care, things like that, making sure that you know and the employees know what they're getting into and what the potentials for hazards are. As far as training goes, we want to make sure the employees are trained on, one, the workplace violence policy itself, as well as the emergency action plan. I've reviewed a lot of emergency action plans where obviously it covers your fires or maybe a bomb threat, but workplace violence isn't very common to be found in these, and it should be a part of that emergency action plan. I've dealt with facilities where they say, well, we'll do the same thing. If there's a workplace violence event or a threat, we'll evacuate, and we'll all go to the flagpole. Probably not the best idea to get everybody in a group if it is, say, an active shooter event. So looking and planning for those and putting that into your training is important. The training should also look at potential hazards. You know, what are the potential threats to the facility? There should be response and controls in that training, basically meaning who's going to be responsible for doing certain activities, whether it might be locking doors or securing areas or making that call to 911. Another thing that should be part of the training is awareness of behaviors for coworkers and clients, kind of looking for those warning signs per se. So what behavioral warning signs would we be looking for? There really is no real profile. Things we want to look for, though, would be increased belligerence. Someone that maybe makes specific threats, said, hey, I'd like to take that person out, or this company's going to pay for it. People that are sensitive to criticism would be another one. Fascination with weapons. Not that there's anything wrong with people that are collectors, but it's a matter of bringing it into the workplace that causes problems. Obsession with a previous grievance. Maybe an employee feels they were done wrong. They were suspended in the past, and they are not able to let that go. Somebody that really is always angry could be a potential issue. Changes in behavior is one that's kind of easier for people that work with others long-term are able to pick up on. Somebody that's maybe happy-go-lucky all the time, and all of a sudden is having issues. It may not be something at work that's triggering them. It may be something at home. And that change in behavior will be noticeable to the employees. Another one would be homicidal or suicidal comments or threats made in the workplace. So all these behavior type warning things should be reported to management, and management should then investigate all of these. When we look at doing an evaluation, once we have our program established and we put things in place, we need to evaluate it on a regular basis. That would be reviewing our written policies, reviewing reports or incident reports, looking at trends in injury data that are associated with workplace violence. We'd want to review safety meetings, and with that we'd want to review not only what was covered, but who was actually present for those meetings. Then we'd want to look at reviewing of any drills we did, corrective actions that have been made, or improvements that have been made, and making sure that they were effective. So when we talk about workplace violence, and then we get into the OSHA realm, OSHA has no specific standard on workplace violence. You could flip through the 29 CFR 1910, 1926, you're not going to find a single thing associated with workplace violence. But OSHA does have a tool to be able to issue citations based on workplace violence events. And that would be your general duty clause. Basically what it states is that each employer shall furnish to each of his employees employment and place of employment that are free of recognized hazards that are causing or likely to cause death or serious physical harm to the employees. OSHA has, though, published directives in dealing with workplace violence. This is the directive that the compliance officers would follow when doing inspections involving workplace violence. The underlined area will be a hyperlink in the presentation, in the PowerPoint, that you will be able to bring up that actual directive. So when they do inspections of workplace violence, they're going to first look at complaints, referrals, fatalities, and catastrophic events. When they do that, they're going to primarily focus on high hazard industries. And we'll talk about what those high hazard industries are in a moment. In addition to that, if a compliance officer is doing an inspection at another facility, they may not be high hazard for workplace violence. But if the compliance officer sees that there is issues with workplace violence, either through talking to the employees or maybe reviewing the OSHA logs, they have the ability to expand that visit to include workplace violence. So as far as high hazard industries are concerned, we look at number one, being healthcare and social service settings. These are your hospitals, residential treatment centers such as nursing homes, short and long-term care facilities, non-residential treatment, clinics and mental health centers, community care and group homes, or your field work, your home health care and your social workers that will go out into the field into a client's home. Other high hazard industries that OSHA is focused on, one, correctional facilities, prisons, jails, and detention centers. And these are only obviously where OSHA has coverage under the Act, whether it's a federal or a state plan. Another one would be night retail, your convenience stores, gas stations, where there's 24/7 operations. So you look at the potential for risk factors being much higher. And another one that comes up is taxi driving. All those are covered right now as being high hazard industries for workplace violence under OSHA. So we're going to look at some specific examples where OSHA has exercised that general duty clause to issue citations on workplace violence. This first one was a serious violation issued with an initial penalty of $7,000. In this case, OSHA said the employer failed to protect employees from workplace violence-related injuries, and that on or before November 1st, 2015, employees were providing services including assisting clients in making meals, doing household chores, and transporting clients. In this particular case, a pregnant employee was hospitalized when she was kicked in the stomach. OSHA came in, they reviewed the OSHA log, and saw that there were multiple incidents of workplace violence. So in that citation, they gave some feasible abatement methods to the company. Those including create procedures for prompt response for clients with outbursts, ensuring staff members are able to provide a proper response, create a policy that violence is not tolerated and that it's conveyed to the clients and family members. They wanted mirrors in hallways and around blind corners so that things would be visible. They also wanted the facility to evaluate reports to identify trends to make corrections. Another example, in this case, a serious violation was issued with a initial penalty of $12,471. Once again, the employer did not furnish employment or place employment free of recognized hazards, so they're utilizing the general duty clause. And they're saying on July 11, 2016, nurses and mental health technicians who provide inpatient care to adolescents were exposed to hazards. So in this particular case, the employees would try to prevent patients from harming themselves, but in doing so, were exposed to serious injury from bites, bruises, sprains, and strains. The feasible abatement methods listed was to evaluate and modify the aggression policy and workplace violence policy. So in this case, the employer actually had a workplace violence policy in place, but obviously was not adequately enough there to protect the employees. So they wanted that done, as well as clear written description of reporting of how the employees can report incidents of workplace violence. Clear statements that the employees will not be retaliated against for reporting cases of workplace violence. And info on how employees affected by workplace violence can seek support. Example number 3 was issued as a willful violation, basically meaning the employer knew of the hazard and did nothing to correct it. In this particular case, the initial penalty was $70,000. The employer failed to protect the employees from workplace violence-related hazards. So on or before February 7, 2014, employees exposed to violent assaults by patients and visitors, including hitting, kicking, punching, that resulted in injuries. In the particular case that they came in on, a nurse was attacked while attending to a patient and was repeatedly kicked in the head, resulting in severe brain injury. So feasible abatement methods associated with this one was they wanted them to install alarm systems or panic buttons, use closed circuit video recording in high-risk areas, and close the nurses' stations to prevent the patients from being able to get to the nurses while they were, unaware. Securing the furniture within the facility. Developing and implementing a workplace violence policy. They had no policy in place. It's kind of why the willful probably came in, is they did absolutely nothing to protect the employees. And then implement and maintain root cause procedures, basically looking at what did happen and then trying to establish how to control them from a root cause perspective. In the fourth example, failure to abate violation. This carried an initial penalty of $197,730. The reason that happened, it was a failure to abate, and OSHA had already been into this facility. They were issued citations. When OSHA came back in because of incidents, because the employees were still exposed to choking, biting, and pulling of hair, they looked and said, you failed to implement the settlement agreement. And the workplace violence policy that they had in training and other measures failed to adequately address the hazards that were in place. So in conclusion with the workplace violence portion, it is a serious hazard that needs to be addressed. And when we look at those 4 types of violence, we need to be able to address all 4 of them. Depending on the environment we work in, all 4 may apply. There are multiple resources available. If you do a web search, the Pennsylvania State Police has resources available that would be able to aid you. Your local municipalities will have groups available to be able to give you outreach, as well as the Pennsylvania OSHA Consultation Program can help establish some of these programs. In talking about the OSHA Consultation Program, we say it's a great service for Pennsylvania employers. We often hear it's the best kept secret of OSHA. I've gone to many trade shows, things like that, and spoke where people have never even heard of the OSHA Consultation Program. Our repeat business kind of tells the story. You know, we have clients that call us out year after year because of the service itself. OSHA On-Site Consultation Program, we are designed specifically for small and medium-sized businesses. When we talk about that, it's up to 250 employees at a single site or up to 500 corporate-wide. We do give, obviously, priority to high-hazard industries or those involved in hazardous operations. Large businesses, we will still perform visits for them, but it would be in a limited capacity or limited scope. And we may look at a specific area or a specific process. Some of the benefits of using Pennsylvania OSHA Consultation. So we are different from the enforcement side. We don't issue citations for violations or penalties for violations. We do ask, and the employer must agree, to correct the hazards that we find. So those would be your serious and imminent danger hazards. The only catch to our program, if you want to call it a catch, is that we must refer you to OSHA enforcement if you basically blow us off. You fail to correct the hazards. This is a very rare case. I've been with the program for about 5 years now, and I haven't had a single one, and I'm actually not aware of any that have happened in the entire program. Cost and savings. It is a free service. So instead of spending hundreds of dollars an hour on a third-party consultant, you could utilize OSHA Consultation free of charge. And in doing so, hopefully you're going to be able to avoid OSHA penalties and litigation costs. You may see reduced workers' compensation costs through the reduction of injuries. And it may minimize equipment damage or product loss. On average, each consultant on site will identify 7 or more serious and other serious hazards. A lot of times it's more than that, depending on the scope of the visit. In that case, we'd have approximate savings of around $87,000 per visit. As far as getting a hold of us, we are located in Indiana, Pennsylvania. Our phone number is 1-800-382-1241. There is always a consultant on call, so if you have general questions, you're able to call and be able to get those answers hopefully right away. As far as social media, we are available on social media. We are either our website or Facebook or Twitter. Questions in general, like I said, the chat room is open for any questions, and I'll remain to keep it open for a while. We will have, like I said, the answers to these questions posted on the web page with the recording as well as the PowerPoint presentation. Our next webinar will be OSHA Fatal 4, and it will be conducted on April 20th, 2018. I want to thank everybody for their time and taking time to watch this webinar, and hopefully you're able to take something from it and be able to apply it to your work locations. I want to thank everybody and have a great day.